Hello and welcome back to the Image Wellness Project. I'm your host, Dominique McMullen. Today's episode is another special one that was recorded live at Wellfest. In this episode, I had the pleasure of sitting down with Dr. Karan Rajan, a man who knows what feels like everything about the medical world. Hands on heart, I had not heard of Dr. Karan before I interviewed him, which is bonkers because with nearly 12 million followers, he's one of the most popular health and science creators around today. He's known for breaking down complicated medical science in a way that just makes sense. And he did that in spades in this conversation. We covered and busted lots of current buzzy wellness trends, things like magnesium and saunas and creatine and protein and the gut-brain relationship and just so much more. I actually can't believe the amount we covered in this conversation. And I made some real life tweaks to my day-to-day after this chat. I think you probably will too. Enjoy. As always, thank you to the sponsors who make the Wellness Project possible. The Image Wellness Project is sponsored by Activia and Irish Life Health.
It's lovely to have you here. How are you?
Yeah, good. This is actually my first time in Ireland.
Your first time.
Yeah,
This is not what Ireland is normally like.
No, I'm sad it's only 12 hours that I'm going to spend here, though.
Yeah. Well, this is definitely not an accurate representation, but I'm glad you're seeing us in the sunshine. It's a beautiful day. So I want to start. We're going to bust some health and wellness myths, which is what you're kind of known for. You're really great at talking about, separating fact from fiction. But before we get into that, for people who don't have access to a doctor like we do right now, how can you go about separating fact from fiction due to the huge amount of wellness information and health information we're getting online all the time?
So I think, we are bombarded with information, some good, some not so good. And I think a few things you can point at is the source of the information. Is someone citing references for any medical claims or health claims they're making? The credentials of the person. So I don't think that just because you're not a dietitian, not a doctor, you can't talk about health.
Yeah.
But if you are actually giving advice about a health thing, I think you always need to back that up with claims. And the final thing would be ensuring that there's some nuance and balance in what someone says. Sensationalist claims or extremes, like very polarizing opinions, seems to be popular online. And if it sounds too good to be true, it probably is.
And unfortunately, that's what the algorithm likes, is those sensational claims. Yeah, so be aware. So I'd love to first get started with the gut, because you are an expert in the area of the gut. And I feel like it's an area which we hear so much about at the moment, and there's so much information about. So let's start with the very basics about how important our gut is for our overall health.
Yeah, I mean, I could speak for hours about the guts. I mean, I'm fascinated with it. I've fiddled with guts legally. Yeah.
As a surgeon.
As a surgeon.
Yeah.
It's really important in every single aspect. And we don't know much about the guts in terms of what we can do down the line. I think it's an evolving area of research. Even the microbiome, it's a buzzword nowadays, but microbiome as a word barely existed in the literature 15 years ago. That's how rapidly evolving this space is. And we know that the microbiome in the gut is involved in skin health, brain health, liver health, hormonal health. There's a subsection of bacteria within our gut that are involved in metabolizing estrogen. It's called the estrobolome. And so there's so many aspects of a health it covers, pretty much every aspect of health, even from hair health as well. Your scalp has its own microbiome. So if you're using harsh shampoos every single day, you are disrupting the microbiome in your scalp. So some natural oils are essential to feed those bacteria. So there's no area that's not touched by the microbiome in some way. And that ultimately also links to the gut.
Talk to me about eating yourself happy and about serotonin production. Is all our serotonin, a lot of our serotonin is produced in the gut? Am I right in thinking that?
Yeah, this is a little bit of a misnomer because 90% of our serotonin is produced in the guts. But that serotonin doesn't cross the blood-brain barrier, doesn't make its way to the brain. The serotonin in the gut is important in allowing the gut peristalsis and contractions, and it's involved with general digestion. But there's other things that serotonin does within the gut microbiome and the gut cells, which can influence other metabolites and hormones, which then interact with the brain.
Okay.
So I think of the gut microbiome as like a colony of ants. Ants don't speak to each other with words. They use chemicals and touch and pheromones to interact. And those same chemicals is what our microbiome uses to chat to the brain. So if you eat certain things like berries, green tea, dark chocolate, nuts, all those things have polyphenols and fibers that feeds the bacteria, and those bacteria produce metabolites which feed back to the brain, and the brain feeds back to the guts.
Fascinating. And when you're talking about foods there, you're talking about nuts, you're talking about berries. What about things like kefir and kombucha and fermented foods? Are they like super feeding that little microbiome system?
Yeah, I think the simplest way to remember it is like the 3 Ps. So polyphenols, foods which are dark shades of purple, reds, you're like beetroots, blueberries, raspberries, blackberries. Those have the highest polyphenol concentration or antioxidant concentration. So P polyphenols are good. Prebiotic fibers, that's a separate subsection of fibers which directly modulates the microbiome. So, for example, oats have a prebiotic fiber called beta-glucan that not only helps to bind cholesterol in our gut, but also modulates the microbiome. And finally, the third
Hang on a second. There was a lot of information just there. Can you say that again about oats?
So oats are a type of soluble fiber.
Yeah.
Oats also contain a specific type of prebiotic fiber called beta-glucans.
Yeah, okay.
Now, beta-glucans directly increase the concentration of bifidobacteria in our guts.
Yeah.
They act as food for bifidobacteria.
Yeah.
And oats, as a soluble fiber, are also important in binding excess cholesterol in our guts and clears it out in the waste. So you poop out more cholesterol, and that reduces the load of cholesterol on your liver. So oats are pretty good for multiple reasons.
Cholesterol, wow.
Cholesterol and microbiome health and protein and fiber. So pretty good.
Eat your porridge.
Yeah, overnight oats are great.
And then your third one that you're talking about for your gut
would be the probiotics.
Okay, yeah.
And that's live cultures in yogurt, kombucha, kefir, things like that.
Okay. And what about off-the-shelf pre and probiotics, the type that you buy in a pharmacy? Are they actually doing anything?
So I'll break down each of them. So probiotics, you need to make sure if you go to a store and you're looking at these supplements, the probiotic supplements, if they don't mention the genus, the species, and the strain, so it needs to have 3 words.
Genus, species, strain.
So, for example, lactobacillus is the species, rhamnosus would be the species, and the strain would be like a number or a combination of numbers or letters.
Okay.
So lactobacillus rhamnosus GG would be a full probiotic, and you can type that whole thing into an online on a search, and you'd find articles which talk about that probiotic. If it only has 2, you are not getting a real probiotic.
Okay. How many do you
You need those 3, like the genus, species, and strain. You need those 3 words and letters in a ingredients list of a probiotic supplement to be a real probiotic, to be a clinically studied probiotic. And the average person who's fit and healthy right now probably wouldn't benefit from a probiotic unless it was for a specific condition.
Okay.
So if you have really bad bloating, if you have traveler's diarrhea, if you have inflammatory bowel disease, irritable bowel syndrome, specific things, and there are lots of specific things, probiotics work, but depending on what that probiotic does.
Okay. So it's not really applicable then to be going into a pharmacy and just buying something off the shelf just because you want to feel a bit better for no specific reason.
I mean, I would say the overall risk profile of that is low. It's not going to harm you. But the very low risk harm is that our microbiome, our gut, likes balance. We don't want any one species of bacteria to overgrow and overpopulate. It's a very closely controlled equilibrium. So if you're taking lots and lots of lactobacillus and you don't need it, you're potentially allowing that to overgrow.
Okay, wow.
And that may not be beneficial. So I think the risk is low. And if someone is taking probiotics, they find it works. And if you can afford it, fine.
Absolutely.
And prebiotics, I do very much believe in these because that's just food for the bacteria.
Yeah.
And I personally have tried, things like guar gum, acacia, inulin. Those work, and they have the most evidence, even more evidence than probiotics.
And where do you get them from?
You can buy them online. They be fibers, basically.
Okay.
They're, soluble and insoluble fibers, but you can get them from food as well. Onions and oats and garlic, any fruits and vegetables.
Okay. So much information. I'm like, I'm trying to take it all in. Talk to me about psychobiotics then, about prescribed specifically foods for disorders like anxiety or depression. How are they working?
So the term psychobiotics is, again, a bit of buzzword. We're not at the stage where we can prescribe a specific type of probiotic for mental health. There's growing evidence that there's certain strains which have a gut-brain link. So when that bacteria ferments certain foods, it produces these chemical compounds, certain types of, they're called short-chain fatty acids.
Yeah.
Those are anti-inflammatory compounds, and certain types of those can improve the brain. So there's evolving, emerging research on that. But I think what you could do to just improve your mood from a gut point of view would be focusing on the things we already spoke about. The prebiotics, probiotics, and polyphenols. That is the most evidence-based things you can do. Okay. The final thing I would add to that, because we've already established this gut-brain connection, the main thing which connects the gut and the brain is the vagus nerve. And one condition, which is like a gut-brain disorder, is irritable bowel syndrome. It's actually not just a gut disease; it's a gut-brain disease.
Wow!
There's a loss of connection, almost like a lost Bluetooth connection between the gut and the brain with IBS. They're not syncing properly. So focusing on stress and regulating the vagus nerve with things like deep breathing, diaphragmatic breathing, belly breathing, things like that can actually help to regulate the gut-brain axis and strengthen that connection.
Incredible. I've never heard that before. That is so interesting. Talk to me about at-home microbiome testing kits. I'm seeing a lot of those at the moment. You test your microbiome home, you send it off, and then they give you a personalized plan for what you should eat for your specific microbiome.
Yeah, I'm a bit ambivalent on this because I think it's a fun exercise. It's interesting if you want to learn more about your health. But, we've got so many, trillions of microbes in our body, in our guts. These microbiome tests maybe test for a few hundred bacteria, a few dozen species.
Yeah.
So I think, you can't expect an at-home test for a couple of £100 at most to tell you everything. But the space is evolving. And I think we will get there with like sort of lab level tests at home. But right now, I don't think we're quite there.
We're not quite there. Okay. So don't bother.
Unless you were interested in learning a little bit more, because they are expensive. They are, some of the top range ones can be £400, £500.
Yeah, it's a lot.
And I think there are other low hanging fruits and easier levers that we can pull to just improve our gut health.
Bit gross, but let's talk about fecal transplants, because I find this fascinating that people in Ireland are doing it now even. I was about to explain. I am not the right person to explain. You explain.
Yeah, so like fecal transplants, or like the full name, fecal microbiota transplant, is where you take bacteria from someone else, you harvest it, clean it up, and put it in a capsule or something like that, and you put it in someone else swallows it.
Yeah.
That is great for conditions like Clostridium difficile. C. diff is a horrible bug that you can get because maybe your bacteria's been wiped out because of antibiotics. If you can get C. diff, which is a horrible bowel infection. That can be life-threatening in some cases.
Wow, okay.
And really cause problems. And in those cases, sometimes a poop transplant can work wonders. But we don't have evidence yet that we can do poop transplants and fix autism, Parkinson's disease, depression, all those sort of things. There is really like a lot of growing research to suggest in mice that we can do that. Like there have been mice studies actually in Ireland.
In
Cork, the APC microbiome lab in Cork, where they've taken the microbiome from an individual who has depression or Parkinson's, and they've taken that sort of poop and put it into a mouse, and the mouse has developed symptoms of Parkinson's or depression. So we know we can actually transfer that across.
Mind blowing.
Yeah. Cool research.
Yeah. Really cool research, and something that I think, and correct me if I'm wrong, that we will see a lot more of in the next decade or so.
Every few months, our understanding of the microbiome and the gut health is advancing at a rapid pace. So I think in 15 years, we might even look back at this conversation and be like, everything this guy said was wrong.
Really?
I don't think so. but there's a lot of stuff that are unknowns, which is why when you speak to people or listen to people online, you should be looking for maybes, could be's, potentially, risk, those sort of kind of slightly cagey balanced terms instead of saying this will do this.
Yeah, because you just don't know right now.
We think based on evidence. Well, that's all we can do, based on current evidence.
Yeah. Could we talk about intermittent fasting? Someone was talking to me on stage here earlier today that they do intermittent fasting. And I was wondering what kind of effect that has on your gut and whether it is this kind of wonder tool that a lot of people talk about it as. Your glucose levels and all of that.
So I'm going to mention a few words and phrases which might sound very sciencey, but I'll explain.
Go for it. We can handle it.
So I think brief periods of fasting or just delaying meals sometimes can be beneficial from a gut point of view, because all a lot of people do in this day and age, and we're all guilty of it, we sort of often graze and snack throughout the day. So we never give our gut bacteria and our gut a chance to just, break and chill out. And what is actually needed is when you're sleeping overnight and your gut is not active and there's no food going through it, there's something called the MMC, or the migrating motor complex, which switches on, and that's the cleanup crew. And I think about it as like a little biological Roomba inside you, and it just goes and cleans all the debris of food, any dead cells, mucus, all that sort of stuff.
Yeah.
And if food is constantly being put into your body, the migrating motor complex doesn't turn on. The vacuum doesn't turn on. So actually having a break from food, so for example, having your last meal at 8 p.m. and then your next meal in the morning at 9 o'clock in the morning. So 12 to 14 hours overnight where you're not eating, that's a good break period for your gut to reset, clear the lining, digest dead gut cells. All those things are needed. And there's certain types of bacteria like Akkermansia muciniphila that are involved in that cleaning process. So brief periods of fasting is actually beneficial, and that can sometimes help symptoms of bloating as well.
So should you be doing that every day?
I don't think someone needs to fast throughout the day, but I think making sure that there is breaks in the day, like even at nighttime, like don't have a late night meal. And then again, you wake up and you have a meal first thing in the morning. Like, there's 6 hours between you eating. Like you go to bed at 11 p.m. and you have a snack before you go to bed, and you wake up at 6 or 7 in the morning and you're eating a big meal as well. If you find that works for you, fine. But if you find also that, your gut could improve, try just lengthening that overnight period where you limit your late night meal and then maybe delay it in the morning as well.
That makes sense. Yeah. I'd love to talk about GLP-1 medicines or Ozempic and the like. Obviously, they're getting a lot of attention in the media. They're breaking records left, right, and center. Who should be taking them and who should not be taking them?
So I think they can be great for, the right person, the right indications. There's probably not enough regulation and medical supervision for the use that we're prescribing them for, because there are so many private clinics that pop up, online clinics that don't even ask a full medical history before prescribing them, because it's sort of, a lot of financial incentives to that. So, GLP-1, glucose-like peptide 1, it is a glucagon-like peptide 1, it's a one type of appetite suppressing hormone. We've got dozens of them in our guts. And you've got GLP-1 receptors throughout the body as well. And so GLP-1 medications can be game-changing for specific conditions because they can massively reduce someone's metabolic risk profile. Because there's lots of people who have fatty liver disease, type 2 diabetes, insulin resistance. And over time, if they just slowly lose weight over years and years, their metabolic risk may still be high for that number of years. So for specific people, it can be, really good and lower their risk profile pretty rapidly. It comes with side effects, of course. So every case should be balanced with that risk-benefit profile. With anything, even if you're taking supplements, you should look at the risk-benefit profile. Do you need it? What's the side effect? Does it balance in your favor?
What are the side effects then?
So one of the ways it works is it slows down your digestion and it slows down gastric emptying. So how quickly your stomach empties its contents into your intestine. Some people, that can cause a bit of acid reflux, bloating, something called gastroparesis, where you get some fullness in your stomach, maybe some nausea. It can cause constipation in some cases. There's some links with pancreatic inflammation. But overall, if it's supervised under close medical supervision and you titrate the dose slowly, you offset the side effects by making sure you have high protein, high fiber, and exercise. I think overall it can be pretty safe if done the right way.
Has there been any studies on its impact on just thinking about the link between the gut and the brain? Has there been any studies on that?
I haven't seen any convincing evidence about the sort of gut brain with Ozempic, but we do know that in obesity, you do get dysbiosis or disrupted gut microbiome. So GLP-1s, if they can improve someone's metabolic profile, their gut profile will probably also improve.
Interesting.
And there's also some evidence that it can improve someone's risk for dementia and Alzheimer's.
Wow.
Yeah.
That's huge.
Yeah.
Wow. Glucose. We are all desperately trying to avoid glucose spikes. I know I am. I had to give up my oat flat white. I didn't even really know why. Someone just told me it was bad for my glucose. Why are we trying to avoid glucose spikes?
Yeah, I think there's a lot of voices online who maybe do overly demonize glucose spikes.
Yeah.
For a normal person, speaking on stage might cause a glucose spike, because the adrenaline rush and stress hormones. If, you exercise, you get a spike in glucose.
Okay.
If you have a bad night's sleep, you get a spike in glucose. So it's a physiological response for the body. If you measure something and don't know why you're measuring it, it's pretty useless. But if it's something that actually causes a negative clinical impact, then that's more useful. And I think if you're measuring it to learn more about your body and your response to foods and your response to stresses, fine.
Yeah.
But I wouldn't worry about a spike just for the spike's sake. So a lot of people, and what I found in clinical practice over the last few years, they will be on these glucose monitors, and they will try to blunt those spikes by eating a higher fat diet.
Yeah.
More fat blunts the spikes, and a higher fat diet worsens your cholesterol profile.
Gonna have other issues, yeah.
So if you're wearing a CGM and just interested in learning about the spikes, great, fine. You're learning more about your body and your personalized physiology. But I wouldn't go out of your way to try and blunt those spikes just for the sake of it. I will say, having fiber with meals is a way to blunt those spikes, and that's always good. Yeah, or walking after meals to, improve your insulin sensitivity and glucose uptake, also good. So all these things are good.
My husband has started eating a carrot, like an actual horse. He just eats an entire carrot. He doesn't even peel it before every meal. And that has made a huge difference for him. And having that bit of fiber, he doesn't feel energy drops after meals anymore. So it's that kind of thing, introducing fiber rather than thinking about it as not introducing the glucose.
Yeah, I mean, if you have vegetables with your meal, or the first thing you eat in your meal is the vegetables, you obviously feel more full, because one of the things fiber does is it stimulates your internal GLP-1 production and cholecystokinin and other things as well. Which
Say
makes
that
you feel
again.
full.
If you eat fiber or vegetable before a meal, it increases your internal GLP-1 production.
Yeah, so the difference between the
Kind of amazing,
medical
isn't it?
injection GLP-1 and your internal GLP-1 is just the timing. So when our cells produce GLP-1, they last and are broken down anywhere from a few seconds to a few minutes.
Mm-hmm.
So not long lasting. GLP-1 medications last for a week.
Okay, yeah.
And so you feel
Big
that fullness
difference.
for a week. So if you have consistent high fiber, your intestinal cells produce appetite-suppressing hormones like GLP-1,
Wow.
like protein YY, cholecystokinin. All of that reduces your hunger signals and the food noise. That's what fiber does. And a lot of people say fiber is a GLP-1. It's not a GLP-1. It produces your natural GLP-1, which lasts for a few seconds to minutes, but it does help.
I never heard that before. That is fascinating. Talk to me about protein. When we're talking about fiber, I feel like we need to talk about protein because everybody's obsessed with protein, and you can see a lot of supplements now. We're talking about increasing protein. I have two questions. One, how much protein do we actually need? Because I know friends of mine who now are eating 6 eggs at the beginning of a day to try and have as much protein as they possibly can. And what benefits do protein have besides building muscle mass?
Yeah, I mean, if you break down proteins like into peptides and amino acids are involved in so many things, from nail health to hair health to skin health. The collagen in the skin, that's a protein. So it's involved in more than muscle building. It's also involved in satiety as well. Your body needs to burn calories to break down and digest protein. So protein and fiber are the hardest for your bodies to digest. So it's actually good for metabolism in that sense. And I think if you look at the studies, it looks like the highest evidence suggests that for optimal muscle protein synthesis, for muscle building or at least muscle maintenance, 1.2 to 1.6 grams per kilo seems to be a good amount.
Okay, yeah.
There's a lot of conversation online right now and in the media and traditional media as well that we're focusing too much on protein and not enough on fiber. And I think you should be focusing on both ultimately. There's easy ways to get a lot of protein and fiber together. I think we should be focusing on foods like that rather than, focusing on individual facets. Like it's either protein or fiber, protein versus fiber. And I think the conversation should be about getting both.
Yeah.
And, things like tofu, edamame, all those things are high in both. Even oats, high in both. So 1.2 to 1.6, to answer your question, is probably like what people should be aiming for. But you also don't need to worry about eating a certain number of grams of protein per meal because your body doesn't keep score per meal. It sort of pools all the amino acids. So as long as you get your protein throughout the whole day in a 24-hour period, that's fine.
Interesting. Okay. So per meal, you don't need to break it down.
No, it's easier to do it per meal because if you have one meal that's 70 grams of protein, it's probably going to be a very big meal.
Yeah.
But your overall total intake is, more important.
Okay. What about creatine? That's a supplement that a lot of people are taking. I think of it, 20 years ago, I remember people taking creatine. And then I didn't hear anything about it until very recently. And now everybody seems to be on creatine again.
Yeah. I think, in terms of the supplements, we know it's sometimes not very regulated as an industry.
Yeah.
Creatine has probably one of the most research papers behind it. I would say, however, that there's actually a lack of research on creatine in women.
Interesting.
And some of the studies that have been done have suggested that the women's natural creatine stores or endogenous creatine stores are actually much lower than men. So it could be of more importance, or women could see greater benefits than men in creatine supplementation.
That's so interesting because it would be men who I would imagine take creatine more than women do.
Yeah.
Fascinating. Let's talk about supplements generally because it's such a big world and there are so many supplements now that we are all recommended left, right and center. What do you think of supplements that promise the world? All-in-one supplements. I'm going to start with them.
Yeah, we see a lot of those, right? The super greens and the multi supplements that has everything you need in the kitchen sink. And again, you look at the risk-benefit ratio. They're expensive. Yeah, probably not a huge risk in terms of your health. There are certain fat-soluble vitamins which, in mega doses, it can accumulate toxicity. Like, for example, fat-soluble vitamins, vitamin D, vitamin E, vitamin A, vitamin K. If you overdose on them on a long period of time, they can cause, some issues. So you need to be mindful of your sort of daily recommended intake. If you need it for a specific thing, like, you're traveling, your diet's not the best, or, you're recovering from surgery or some sort of injury, I think sometimes a multivitamin or some sort of supplement can fill in the gaps. And I think it can be beneficial. And we're not even including supplements for specific use cases like pre-pregnancy, preconception, during pregnancy. Those are all different categories.
Absolutely.
We're talking for an individual who's completely fit and well. I think there's probably not a problem, but you just need to be mindful of doing your own due diligence. What's inside there? Are you doubling up with other things which overlap with the ingredients here? And are you getting too much of one thing? And also making sure they're safety tested, purity tested. Where is it coming from? Social proof. What are people saying online about this? You need to do all those checks.
I definitely have never thought about overdosing before. I would be known to do like one sachet of whatever it is in the morning and then another one at lunchtime if I'm feeling a bit groggy. So good to know. Talk to me about vitamin D. It's something that, we're not low on it this weekend, but in Ireland generally we're all deficient in vitamin D. How can you balance supplementation with a bit of sun exposure with just diet?
So on a day like this, if you were, even 20% of your body was exposed to this sort of sun for 15 minutes, you would maximize your skin's ability to produce vitamin D.
Okay, maximize
Right?
your skin's ability to produce.
So you can't overdose on the sun when it comes to vitamin D. Your skin will just cut off. Like, okay, we've done.
Yeah.
We've produced how much we can. We're done. On a cloudy day, you maybe half an hour outdoors would maximize your, vitamin D production from your skin. That's one side of the equation. You're also consuming vitamin D from your diet as well. So you're thinking of dairy, oily fish, dark greens, all contain vitamin D, mushrooms, things like that. That also accounts for a small amount. But I think supplementation for a lot of people also will do some good. I mean, I did some blood tests 2 or 3 months ago, and I was very, very low in vitamin D.
Me too.
I've also got darker skin, which makes it harder for me to create vitamin D because of the melanin blocks some of the UV as well from the sun. So I still supplement with vitamin D. So I think a combination of being mindful of all three, appropriate dose of supplementation, exposure to enough sun that you can produce from the vitamin D from the skin, and ensuring your diet is rich with vitamin D food sources as well.
If you're wearing sun cream, are you still getting the vitamin D that you need?
Yeah, so sunscreen does block some UV. It says like 97% of UV blocked or whatever it says. So you're still getting some, UV exposure. It won't make you vitamin D deficient. It's not going to significantly reduce it. If you're wearing sunscreen and you're still outdoors for 20, 30 minutes, you will still max out your vitamin D production. So you still need to be sun safe as well.
Of course. I recently got actually prescribed vitamin D that I can take once a month, which is life-changing.
Injection?
No, it's just a little capsule that I just take, and it's once a month worth of vitamin D. Please don't tell me that's not.
No, yeah, that is a treatment protocol. You can do weekly, monthly doses, and I think there's even yearly doses as well. And what I would say is that anyone taking vitamin D, also make sure that your magnesium intake is also there, because magnesium is a cofactor for vitamin D. Another important factor is ensuring you have enough vitamin K2 with vitamin D.
Okay.
So vitamin D, if you take it, it wants to go into the bones. You don't want it to be deposited into your arteries or the lining of your arteries, because it can cause calcification of those arteries. Vitamin K2 is like, if you think of vitamin D as like the delivery driver, and vitamin K2 is like the GPS. Vitamin K2
tells it where to go.
Yeah, it tells it to go to the bones, not the arteries. So vitamin D3 and K2, vitamin K2 together, and you can get those supplements combined form as well.
Can you get K2 in any foods, or is that better as a supplement?
You can, but usually most people would consume it in their diet, but often I find it's better if I am taking a vitamin D supplement. It comes as a vitamin D3 and vitamin K2 supplements.
Okay.
So I personally take something like that.
You touched on magnesium there. I'd love to hear more about magnesium. It's kind of this wonder supplement for sleep, for energy levels.
Yeah.
Or there's like magnesium, creams and gels and all sorts to put on your skin before sleep. Is that based in science?
Yeah, I mean, if you look at it depends what you're using magnesium for. There are so many different salts of magnesium. There's magnesium citrate, magnesium oxide, magnesium glycinate, magnesium threonate. There's so many different types. And each of those compounds have a slightly different focus. So magnesium bisglycinate and magnesium L-threonate, they're more towards brain, mood, stress, anxiety, sleep type stuff.
Okay.
Magnesium oxide, magnesium citrate, things like that are more towards bowel and laxative type effects. But they all have similar overlapping effects, and again, it's looking at what do you need it for.
Yeah. Can we talk about mushrooms?
Yeah.
And adaptogens? I'd love to hear your thoughts on things like lion's mane, cordyceps, mushroom coffees, and then also I keep getting advertised on my Instagram this microdosing mushrooms, basically, from this really slick looking cool brand, talking about how it reduces period pains and helps focus. I'd love to hear your thoughts on all of that.
So I think when it comes to those, we're seeing a boom in functional food and beverages.
Yeah.
Everything from probiotic sodas, prebiotic sodas, mushroom coffee and all sorts. And ultimately, there's so many different factors which goes into understanding whether it's right for you, from cost to taste to where does it fit in your life, how is your other diet. Ultimately, if your sleep is terrible, you're doing zero exercise, you're eating zero fiber, there's no mushroom coffee in the world that's going to change the game for you, right?
Yeah.
And so the evidence for mushroom as an additive and adjunct to these functional food and beverages, I think it would say it's emerging at best. You
Okay.
can't say that this will definitely do this. So if you think of supplements as a continuum, at the upper end, you'd say fiber supplements, creatine, vitamin D, omega-3, magnesium, all those things have great evidence and are like top tier supplements. And at the other end, you've got some really dodgy ketone supplements or Herbalife and stuff like that.
Yeah.
And then somewhere in the middle, you've got all of these other functional food and beverages. And if someone is taking them and seeing a benefit, great. And if you're not, look at other lifestyle factors. So I think, that's my sort of diplomatic
That's
answer.
not a glowing recommendation for the mushrooms then.
I think listen, if you eat mushrooms, yes.
Yeah.
Psychedelics, there's again fantastic
Yeah, interesting
research
evidence
in
there.
microdosing psilocybin, LSD for refractory depression, treatment-resistant depression, PTSD. So yes, so like on a pharmaceutical grade and even nutritional level mushrooms, there's good evidence that it's helpful for health in general.
Mm-hmm.
These functional food and beverages, I think you'd always want to lean on dietary factors and lifestyle before having that as your save the day thing.
Of course, yeah. It's always, unfortunately, the boring standard stuff that's the most important stuff to get right. Yeah. Longevity is a really interesting area in health and science at the moment that has heaps of research behind it. I'm curious what you feel about that, and also how do we go about increasing our health span rather than our lifespan?
Yeah, I mean, it's back to those sort of boring things. And I think in this longevity space we're in, there's a temptation to focus too much on supplements and optimizing via supplements.
Yeah.
And it does really come back to those core factors. I mean, if longevity or health span is the roof of a house, it's held up by various pillars from sleep to nutrition to activity. And I think... So the Lancet, which is a medical journal, released something called the Lancet Commission Report in 2024. And that commission report looked at 14 different lifestyle factors which contributed to dementia, modifiable factors. And they said that actually they believed up to 70% of dementia cases could be prevented if we optimized or targeted those factors. And I think we can apply those same factors to longevity in general.
Yeah.
Because aging and sort of dementia are similar as well in a stage. So a lot of those factors included things like blood pressure monitoring. Undiagnosed high blood pressure is a silent killer, and a lot of people probably have high blood pressure and they don't know it because how many people get a blood pressure check? I think if you're over the age of 30, you should probably check your blood pressure once a year at least.
Wow,
if you have family history of heart disease or high blood pressure, maybe consider checking it more if you've got high blood pressure. So high blood pressure, just being more mindful of that. Whether it's buying a simple, cheap 10-pound blood pressure cuff from Amazon or next GP appointment, doing your blood pressure once a year. It's an easy thing to, keep control of and keep track of. Number 2 would be, if you're over the age of 30, getting, a blood test once a year.
Yeah.
And there's 2 very important things that I look for myself in my own thing. Is your cholesterol profile, specifically LDL cholesterol. And second thing would be your HbA1c, which is a marker of long-term blood sugar control.
Okay, I've never heard of that before.
HbA1c, if that's very high, that can push you towards type 2 diabetes, pre-diabetes, things like that. So those 2 things are important to look for. Other things like isolation. Isolation is linked to mental health issues and also depression, Alzheimer's, things like that. Eyesight and hearing. A lot of people have poor hearing beyond the age of 50, and that's also correlated with things like dementia, cognitive decline.
Wow.
So there's all these sort of very obvious factors that we don't focus on, and we focus on other things, like supplements instead of these other things. And so beyond sleep, nutrition, exercise, these other things that we can actually see a metric of, like blood pressure, cholesterol levels, those are really
the basics.
Yeah.
And are those tests you think then people should be getting yearly, in their 30s? And does that change then as you get to your 40s? Are there extra things that you should be adding on?
It also depends on what your other medical factors are like.
Yeah, of course.
So if you're over the age of like, okay, so you can be the healthiest person in the world. You can exercise every day, do resistance workouts 5 times a week, have loads of fiber, and just be and sleep really well. And unfortunately, you can still be, cursed with high cholesterol because genetically you might be predisposed to high cholesterol. Just like you can be the healthiest person in the world and you can still get bowel cancer in your 40s or 50s. We're not immune from any disease. So someone who's really fit and healthy in their mid 30s, you can't just assume you don't have any problems. You need the evidence and the proof. And that proof comes from looking at things which you can actually physically and tangibly see,
And measure.
like a blood profile.
Mm-hmm.
And, sometimes like your GP probably in the UK and Ireland, they may not do blood testing for if you're completely fit and well. There's no reason to do that because it's expensive for the NHS. But you can also get cheap private tests online or whatever, at home tests as well.
Yeah.
For quite cheap. And again, it's an investment in your health for 30, 50 pounds. It's like a gym membership.
We were talking backstage before we came on. We were looking at the audience here and seeing how many women there are here at Wellfest. And we were talking about how women are so much better at looking after themselves and going to the doctor and getting those tests. What do you think about men doing that? Why do you think they're not doing that? And what do you think the women here today? I can see one man other than the crew. What do you think the women here today should go home and say to their partners or their brothers or their fathers to convince them to go and get checked?
Well, I think a lot of men risk dying of embarrassment. And I'll give you an example from my own clinical practice over the years. There was a guy that I saw when I just started my surgical career. I was working in urology at the time. So, urogenital health. And he came in with, stage 4 testicular cancer that had spread throughout his whole body. And he was in his late 30s. Testicular cancer, for example, is a highly curable cancer if it's caught early. Similar to like skin cancer or other things like that. We have really good treatments for it. He had noticed a lump on his left testicle and he had actually stopped going to those. So he used to play football, 5-a-side football with his friends every Friday. When he noticed the lump, he stopped going in the showers after football because the lump kept getting bigger. And it was the size of like a football.
Jesus.
On his left testicle. So when I saw him in his assessment, I was actually shocked. I'd never seen a testicle that size before. And, I was sort of, awe-inspired, but also I was like, this is really bad. And unfortunately, the outcome prognosis is really bad for him. But that was an example of how, he just doesn't want to talk about it because the average man, we were talking about it before, a woman might speak pretty freely to her girlfriends about a lump that she's found on her breast or some discharge she's experienced that's abnormal. In a pub, Tom and George aren't going to talk about a rash on their penis or lumps on their testicles with each other over a pint.
No. Or if they do, it'll be in a very rude, crude, whatever way. Yeah.
So I think that's the difference,
Yeah. Let's all go and get our men in our lives to go to the doctor, please. What about the different kind of holistic medicines, things like meditation, which obviously has thousands of years of anecdotal evidence behind it? How important are those things? Do you ever prescribe those things to people?
I think, there's an increasing trend in the UK called lifestyle medicine, and there's sort of, social prescribing where people are more cognizant of these other lifestyle things. Like in Japan, the doctors actually prescribe those sort of things. One of the things they prescribe is forest bathing, where you go and take a walk in nature, and that's beneficial.
Gorgeous, yeah.
There are a few limited studies looking at the role of yoga and meditation on the brain. Like they've done these functional MRI studies where they've looked at people who do yoga, religiously, or meditation religiously, or mindfulness, and you actually see less activation in the amygdala. The amygdala is part of the brain which is like the fear center. Mm-hmm. That's reduced, so less stress. And the prefrontal cortex, which is like our, executive decision maker, that's had a higher degree of activity as well, which suggests that you're more in control of certain actions and, more empowerment. So, there is growing evidence for those things clinically as well. We've had that evidence for thousands of years, but now we're getting the data also to back it up.
What about breath work? Similar vein.
Yeah, breath work, what it is, it's a form of diaphragmatic breathing, which we stimulate the vagus nerve, and we know the benefits that can have in reducing stress. So that also has good science behind it.
I've got two more questions. I want to get in a question about phones because I feel like
Phones.
we're all beating ourselves up all the time about
Yeah.
too much phone time, too much screen time. It's pumping up our cortisol levels. It's having a terrible effect on our focus. Is that all evidence-based? Is that science-based?
Yeah, I mean, there's been a phrase that's briefly quoted called digital dementia, where all sort of, declining attention spans and memories and focus and things like that. And I don't think that's just because of phones necessarily, but probably because of more lack of contact in the real world.
Yes.
So I think phones are great. It's made us more connected in one sense, but I think phones isn't a bad thing necessarily because it gives us knowledge. Being plugged into the internet and having knowledge is always great. And if you continue that knowledge throughout life, that's actually a protective factor against cognitive decline, as long as you use it appropriately. I mean, if you're just playing Fruit Ninja for hours on end,
What's wrong with
on
Fruit
your phone,
Ninja?
but it's all dose dependent. So if you overdose on that, not good. But if you're using your phone to listen to podcasts that educate you or whatever, it's great.
And my final question is, what one habit would you like everyone to leave here today? One health habit, one longevity habit, something that will improve their health.
Probably people are tired of hearing this, but honestly, like eating more fiber, and as someone who's seen the benefits of that.
Yeah.
So in 2018, I had high cholesterol. And in 2019, after increasing my fiber intake to 35, 40 grams a day, my cholesterol was normal again. And so I think the role of fiber, so there's, if you increase your fiber intake by just 8 grams a day, you lower your colorectal cancer risk, your bowel cancer risk by 8%.
Wow.
So as an example, 2 tablespoons of chia seeds that you, add to your overnight oats, that's 10 grams of fiber.
Oh, wow.
Right? So it's a very easy lever to pull.
Any other fiber foods that you'd recommend then?
So a nice one would be a 25-gram piece of dark chocolate, over 70% cocoa.
Lovely.
Is 3 to 4 grams of fiber.
Lovely.
Right.
I can definitely do that.
Yeah.
Chia seeds and some dark chocolate.
Yeah. There you go.
Thank you so much, Karan. Please join me in thanking Karan for a fantastic,
no worries.
informative.
Thank you.
Thank you for listening to this episode of The Wellness Project. This is the part where I ask you to please like and subscribe. It really does help us reach new listeners, and I know so many people could benefit from a conversation like that one. Remember also to keep an eye on image.ie for lots more information and insights and expert advice on all things wellness. I will chat to you next week. And until then, please do mind yourself. The Wellness Project is sponsored by Activia and Irish Life Health.